Hello and welcome to Back to Basics Virtual Massage for the wrist, elbow, and hand. So many times with exercise or with new tasks that you do that you don't do all the time, maybe painting, maybe hammering, maybe holding things with your wrists in a contracted way, is very challenging for the body to release that once you've told it to do it numerous times. What I want to show you over the next couple of minutes is how I work on myself to relieve pain that I have in my wrist, in my hand, fingers, forearm, and elbow. What we're going to start with are some basic stretches. I actually will lay my hand down like this, use my other hand with my fingers, and gently pull back. Taking nice, slow, deep breaths. When you exhale, make sure you tell that muscle to release, let it relax. Oxygen intake is huge, very important. So make sure you're taking deep breaths and then let that go. We're going to go the other way also. Holding your arm out, pulling your hand back, breathing in. Exaggerated exhale, telling that muscle to release. We'll do the same thing with the fingers. I'm actually going to push those fingers back all the way through each one of them, including the thumb, in each direction. You'll be letting your arm rest down, taking your thumb back to a comfortable stretch. Don't overstretch. You want it to feel effective but not invasive. Also, because the thumb, obviously, you can move in numerous directions oppositionally, which is unique to the human hand. So what you also want to do is pull the thumb in all of those directions. So pull that thumb towards you. Disengage and relaxing. Down and across. So you're actually pulling that thumb across your palm of your hand to stretch these lateral extensors back here. Straight up and back and in every single direction. You can do that with every finger, forward and backward. Flexion and extension and stretching all of those areas. Next, what you'll do is you'll work in the palm of the hand. And I don't have any lubricants yet. You'll work in the palm of the hand with your thumb up through the arch towards your wrist. So you can let your hand down, you can let it rest on your lap, on a table, on your desk. I'm on my kitchen counter, and I'm working through. When I get to a certain spot right there, I can flip over it. That tells me there's hypercontracted fiber. I want you to take your fingers, let your hand rest, find the on spot. And by that I mean you'll feel it be cable-y, and when you put your thumb on it, it'll kind of flip off. Gently, with less compression, find and get on the right spot, and then hold that there. So in my pollicis muscles coming across my thumb here that flex my hand oppositionally across, which I've been doing with a paintbrush. I've been doing it with a fishing pole during these extra days off in these unusual times that we're experiencing, and mine is hypercontracted. So what I'm going to do is use my thumb again to find those spots, kind of hold in on those spots. I'm applying pressure straight down. If this is uncomfortable for you to do with your hand or your arm, you could let it across you this way, and you could use your thumb this way. So I would come in on an angle like this, and I would find that good hurt spot. You want to apply enough pressure that feels effective but not invasive, just like every other area of the body that we would work on if you were in the office. It's again the same techniques, just another area, whether we're working on the shoulder or the hip or the back or the leg or the knee, or in this case, the palm of your hand and thumb. From there, we're going to go to the wrist. Again, using the back of your thumb, kind of coming always towards the heart. I'm kind of stripping through the muscles of my wrist, applying a moderate amount of pressure. It feels good, like a good hurt. You know, those are my favorite words. And then I'm actually going to use my knuckles in my forearm. In this direction, or in this direction, or my thumb, again, holding my hand like this and just kind of troweling through my forearm muscles upwards towards my heart, trying to strip through these muscles. And again, I can feel cably flipping. At that point, you can actually use a little oil. I have a little doTERRA lavender. You might want to use a drop or two so that your thumb glides a little easier along the muscle. But when you find those good hurt spots, go slow. Stop, hold, breathe, instruct that muscle. Give it permission to turn off. Your muscle will thank you when you're done with these techniques, trust me. And work right up into this antecubital area of your arm here. And you're going to use your thumb. When you get up into this area here, you might want to switch to your fingertips, and you're going to find those good hurt spots and again hold. And this is all for discomfort I'm feeling in my hand and my wrist and my fingers and my knuckles. Just because I feel the pain there, that's not the only place that could be contributing to that discomfort. It could be coming from my shoulder. In fact, my shoulder could hurt because of my hand getting fatigued as I'm painting or as I'm using it with a tool in a different way. Because as I hold that tool and my hand gets tired, I start using more of my body versus just that hand. Now I'm using the forearm, I'm using my upper arm, I'm using my shoulder, putting my whole body into it, and then it ends up fatiguing everything. So again, there's another video on shoulders. I would encourage you to go back to that. Do those techniques as well. Even though it's your wrist or your hand that's bothering you, there are muscles in our the anterior chest area, the shoulder area, the back, and especially underneath in this area here. In fact, that is a place that I would primarily have you focus on in that armpit, in the seam, where you're going to be using compression of your fingers into your ribs, of your thumb up into your armpit, looking for hyper-contracted cables, feeling for those tender, good hurt spots. You want to find those. Don't keep moving over them. Hold them. Focus on them. Breathe through them. Tell the muscle to release. You'll feel relief in your wrist, in your thumb, in your hand. Let's come back to this antecubital area. There's a muscle here called the brachialis. It will specifically refer pain into the thumb and wrist area. The subscapularis underneath in your arm will refer into the wrist specifically. And also the bicep can refer down into the arm, into the hand. So working all of these muscles will definitely be beneficial. And both sides. So let's turn the arm over. Use a couple more drops of oil on the back of the arm, your forearm area. And again, we're going to come through the wrist. We're going to come through the forearm. You're going to work all through here. First, just kind of stripping through. Not super deep, but not just flushing either. Although flushing is definitely beneficial too, to remove any kind of inflammatory fluid that might be in the way, lactic acid. You could just flush all the way up your arm, all the way through and into your shoulder, all the way up the back of the arm, through your armpit and across this clavicle, front of your armpit, pec area, right into the clavicle and up towards your neck. This is the lymph flow, and this is light. It's not heavy pressure. This is just light stroking, and this is beneficial also because the hypercontracted muscles that you're getting to release are going to release lactic acid as well. You're flushing inflammatory fluid out of the way. So those are techniques for the front of the arm and the back of the arm all the way through. When you find, remember, those hypercontracted fibers, stop. Hold on them. Don't bully them, but apply enough pressure that it feels effective and not invasive. And again, I hope these techniques help you with any kind of wrist, hand, elbow discomfort. And again, check out the shoulder video because that will help as well. Until the next time we work on maybe the neck or the jaw, knees. There's lots of areas I'd love to cover for you. I hope these techniques help. God bless.